And a surprising amount of people are affected by something called psoriatic arthritis. And there's a new initiative actually to help them cope with this disease.
And Alex had the opportunity to talk with a couple people who can tell us a little more.
Well, there is a condition called psoriatic arthritis, a painful and debilitating chronic disorder that impacts 780,000 Americans and 38 million people worldwide. The emotional impact can be just as difficult as the physical, and there's a new patient-driven educational initiative to help people living with psoriatic arthritis manage their disease. Here to tell us about it are rheumatologist Dr. Joseph Markenson and chronic disease coach Rosalind Joffe. Good morning to you both.
Good morning.
Good morning, Alex.
So let's start with you first, Doctor. Oh, sure. Go ahead.
Okay. Symptoms: arthritis, painful swollen joints accompanied by systemic features such as fatigue and morning stiffness, really impacts upon your lifestyle. You want to talk a little bit about?
Sure. So one thing that we've seen over the years is that when you live with unpredictable, waxing and waning symptoms, not only are you physically unclear about what you're going to be able to, not only are you unclear about what you can physically do, it is also a mental issue that goes on here, because all of a sudden now you're faced with not being able to rely on this body that you thought you could rely on. And that's a game changer for a lot of people, particularly when you're dealing with something like psoriatic arthritis, where there are now medications that can be really effective in managing the disease itself. It's very important that people figure out where to find the kind of help that they need. And that's why the Say Yes program, pSay.com, which is a website that people can easily access, gives the tools that patients need to figure out, to determine what they need to take charge of their lives. And there's resources here, including tips from patients themselves.
Medications have really worked. The last couple of years we can really do something about arthritis. But to get it done, the patient themselves has to be able to go to the doctor and describe what's going on. Many patients don't want to do that, and we ask them to go to this website. They'll listen to other patients, and it maybe will empower them to be able to direct their doctor's visit and get a proper diagnosis and treatment.
Well, and doctor, how would you say that this disorder, this disease, affects people's career and their life? I mean, what's really the long-term effect of this?
Well, the long-term effect, if gone unchecked, will cause destruction of joints, disability, the need for possibly surgery to alleviate the pain. It's a disabling disease. Medications can reverse that. It can put people back to normal activity. Yes, you will be taking medication maybe every day of your life, but you'll be functioning normally, and that requires you getting that diagnosis and getting on a proper therapy.
Well, I agree, and that's why, you know, Rosalind, you come in. Why is disease management so important?
So, actually, what I don't do is disease management. What I really focus on with people is managing themselves. The disease management is what the medications can do, thankfully, and that's where people like Dr. Markenson comes in. But what you have to think about when you're a patient, and I'm someone who's lived with chronic illness for over 35 years, you have to think about what can you do, what's possible, what's not possible, set expectations for yourself and for others so that you aren't disappointing yourself and others, and that you can be as successful as possible, given what you're living with. And one of the things that we haven't mentioned is that this is a disease that often affects people between ages 30 to 50, and that's prime career and family building years. So you've got a lot on your plate, and it's also a time in which most people look and seem pretty healthy, so you feel alone. That's why this website, psayyes.com, is such a useful tool, because it gives patients the ideas that they need so that they can take charge.
And it's also important on expectations to direct me, the physician. I'm going to treat you by virtue of what you can't do, and unless I know that, I'm not going to correct a good program for you.
Right. Well, Dr. Markenson and Rosalind, thank you guys so much for coming on and sharing this wonderful resource for people.
Thank
You're
you.
welcome. Thanks for giving us the time.
And stay where you are. We'll be right back.